Hello, my name is Clara Chong. I will be discussing Topic 2, Behavior Change and Exercise. This presentation will include journals that support the social cognitive theory and other behavioral models. There will also be journals about different behavior change models that doesn't necessarily fall under these models or theories. Last but not least, we will consider the role of healthcare providers in improving physical activity in multiple populations. The first health behavioral model I will be discussing is the trans-theoretical model. As we learned in class, this model is divided into 6 stages. Stage 1 is pre-contemplation. In this stage, people are unaware or indifferent to unhealthy behaviors. In the contemplation stage, the person starts to recognize a problem. Then comes the preparation stage, where the person attempts to make small changes in their lives. This person eventually reaches the action stage, where he or she makes obvious changes in his or her life. To be considered in the maintenance stage, the person has to be consistent in their actions for at least 6 months. The final stage is the termination stage. This does not mean that the person stops doing what they've been doing, but that they are certain that they will not regress to previous unhealthy behaviors. The trans-theoretical model is non-linear. This means that people can move back and forth between these 6 stages. The journal that we will be looking at is titled The Effect of Trans-Theoretical Model-Based Education and Follow-Up on Providing Overweight Women with Exercise Behavior. The author of this journal believes that protective measures should target overweight people who are not obese but have the risk of developing obesity. The group studied consisted of 110 female between the ages of 20 to 45. The experimental group participated in a 10-week education program, and there was a 6-month follow-up period. This study supports that the trans-theoretical model was effective in building exercise behaviors on overweight women. Here, we look at the social ecological model. As the name suggests, this model relies heavily on social and environmental support of an individual. The figure on the right is a figure obtained from the journal that we will be discussing. The figure on the left is an original figure explaining the social ecological model. You can pause this video to look at the differences, but I would like to point out the different terms labeled for each section, such as microsystem versus relationship or interpersonal, and so on. The title for this next journal is Multiple Influences on Participating in Physical Activity in Older Adults, Developing a Social Ecological Approach. A group of 60 older adults aged between 50 to 87 years old were recruited in West Yorkshire, United Kingdom. We will look at personal quotes from the participants. A 65-year-old active male quotes, "Table tennis has been a savior for me, really, as a focus for my physical activity, but also just to occupy me mentally." So physical activity plays a role in an individual or interpersonal level for him. The next quote by an 80-year-old female relates to an interpersonal level where she expresses that it is the best thing I ever did coming down here. I joined people who were like myself, you see. Other older adults talked about other examples that fall under different levels. A statement relating to perceived environment level was about having access to a bus pass and how that has helped increase an old lady's physical activity level. As a conclusion, healthcare providers should determine the level that plays the most significant role in their patient's life and offer activity sessions according to the social ecological level of their choice. Next, we will look at the health belief model. This model emphasizes the perception of an individual towards a situation. Modifying variables includes factors that can influence an individual's perception, such as their psychosocial state. The other parts of this model are perceived seriousness, perceived susceptibility, perceived benefits, perceived barriers, perceived threat, self-efficacy, and cues to action. It is important to know that for any change in behavior to occur, the perceived benefits has to outweigh the perceived barriers. All these factors affect the likelihood of an individual engaging in health-promoting behaviors. For this model, we look at the physical activity level of pregnant women. Multiple studies have shown that physical activity during pregnancy decreases the risk of women experiencing gestational health issues. Health issues that may arise in pregnant women include gestational diabetes and gestational hypertension. Both can be deadly to the mom and fetus. 90 women in their first trimester participated in this study. The intervention group received education about physical activity based on health belief model. The control group received dental health education. Routine education was provided for both groups. A month later, it was recorded that an increased level of health belief in pregnant women increased their amount of physical activity. I would like to note that even though there was an increase in physical activity, it did not reach the adequate physical activity level of 150 minutes per week. On this slide, we look at Bandura's social cognitive theory. This theory is an expansion on classical conditioning and operant conditioning. An example for classical conditioning is salivating in response to the smell of food. Operant conditioning includes key concepts of positive and negative reinforcements or punishments. For the next slide, we will focus on self-efficacy. Self-efficacy is later added into the social cognitive theory. Self-efficacy can be defined as the beliefs regarding the individual's capabilities to successfully carry out a course of action. The title for this journal is Implications for Physical Activity, Function, and Functional Limits on Older Adults. This journal compiles evidence that suggests the importance of self-efficacy in physical activity level and function of older adults. The main idea from this journal is self-efficacy goes hand in hand with functional limits of older adults. A quote by Albert Bandura sums up this journal perfectly. People's beliefs about their abilities have a profound effect on those abilities. Other behavioral change strategies that could possibly influence physical activity levels are shown here. The first one is self-talk interventions. This can be divided into motivational and instructional self-talk. An example of motivational self-talk would be, hang in there and stay strong. Instructional self-talk refers to statements that focus on task-relevant cues, such as high knee lifts, reach, and bend while performing these actions. The title of this journal is The Influence of Self-Talk Intervention on Collegiate Cross-Country Runners. This journal also talks about self-efficacy. Next on the list is social support, specifically family-centered programs. This study aimed to investigate the effect of family supportive intervention on the level of support among congestive heart failure patients. The results for this study shows that familial support has a positive effect on congestive heart failure patients. The next journal is Why Peer Crowd Matters, Incorporating Youth Subcultures and Values in Health Education Programs. Peer crowd targeting is introduced as a strategy for health behavior interventions in youth. According to this journal, by replacing unhealthy behavior norms with desirable healthy lifestyles, peer crowd targeted interventions can have a lasting impact on the target audience. Lastly, we will talk about applying person-centered approach with other motivational theories. The conclusion of this journal is that more research should be conducted on the use of person-centered approach and self-regulation theories. The last two journals I found suggest the use of behavioral change models and theories to help increase physical activity level of two different populations. Results from the Canadian Centre website showed that of all the behavior change techniques provided, only 20% of these techniques were used. The most effective technique is used inconsistently. The last journal, titled Training Clinicians to Implement Behavior Change Strategies for Physical Activity Promotion in Neuro Rehab, focuses on healthcare providers increasing their knowledge regarding the use of behavioral change strategies to promote physical activity among individuals with neurological conditions. As a conclusion, multiple health behavior models have been proven to be effective in increasing physical activity in different target populations. Also, more research is needed to support the use of behavior change models to increase physical activity. To end this presentation, I have a quote by Nelson Mandela. Exercise is the key not only to physical health, but to peace of mind. And here are my references.